One of the biggest problems with the United States healthcare system is the incredibly high cost of healthcare. This is an issue because it results in inequities where rich people are not burdened by their health, but poor people are. There are many factors that play into these costs that experts have talked about, such as Bhattacharya et al. An example of these factors is how our healthcare system was built to favor specialists over generalists. But what if sickness could be prevented, thus allowing consumers to avoid those high costs? Rishi Manchanda, a doctor who worked in Los Angeles, once told the story of three friends, connecting it to the U.S. healthcare system and what it needs. The story goes that three friends came to a river where children were floating down toward a waterfall in need of rescue. The first friend dove in and began saving children that were about to fall over the waterfall. The second friend began building a raft to ensure less children end up near the waterfall's edge. And the third friend swam upstream to discover what was putting those children in the water and put a stop to it.
I represent specialists such as ICU nurses.
I represent primary care clinicians.
And I represent those who aim to stop sickness at the source, upstreamers, if you will.
This third friend in our story also represents what can be called preventive care, steps that one can take to help prevent sickness before it happens. Bhattacharya et al. In their book Health Economics explain one part of the Grossman model for the demand of healthcare that breaks all the time a person has into two categories, productive time and sick time. This productive time is broken down into more categories, working, playing, and health improvement. This last category is best defined as time one spends to increase their health, which can also be called preventive care in that it reduces the person's chances of getting sick. This also increases their overall productive time, allowing them to spend more time as they wish, rather than spending it in bed recovering from sickness.
A point Manchanda brings up is that preventive care can be seen in one's work environment and home. One problem is that people do not know about the preventive care benefits provided by the workplace. An article written by Barry stated that in a study of adults aged 18 to 65, 48% of the participants believe that all medical tests applied toward their deductible, unaware that preventive tests or screenings, or both, would cost them little out of pocket, which means almost half participants thought preventive care was more expensive.
An article written by Schulter and Levenshurz explains that employers remain a trusted source of medical information, and an effective communication campaign can raise the rate of employee and family uptake of preventative care. Employees and family members can lose precious time together if they don't get appropriate preventative care, which ties back into the Grossman model explained earlier, in that those who practice preventative care increase their level of health, which in turn results in the individual having more time to use as they wish.
In addition, an article written by Dahlmeyer, Wicker, and Brewer states that people ages 50 and older in 27 European countries, plus Israel, were studied from 2004 to 2015. The focus of the experiment was to see the relationship between people's out-of-pocket costs for health care and the amount of physical activity they did. What the study found was that those who reported physical activity once a week showed a negative relationship with the amount of their out-of-pocket costs, meaning that those who exercised more generally paid less out-of-pocket for their health care due to the investment in their health.
In conclusion, we urge people to use preventive care rather than waiting for emergencies to seek medical assistance, to talk to your employer about what benefits they offer their employees, and to also look into activities you can do on your own, such as exercise. An example from vibrantlife.com is a walking program where you cycle between walking fast for 3 minutes and strolling for 3 minutes for 30 minutes over the course of the day, meaning those who follow this program can split their walking over the day. For example, 10 minutes before work, maybe 10 more on a lunch break, and maybe 10 more minutes after work. The result is that you may find yourself with more time, more health, and more money to use as you wish.